Hello, you are very welcome to this talk, and today I'm going to talk about the developmental assessment of children. This is a very common clinical scenario which is given in the MRCPCH, which stands for the Membership of the Royal College of Pediatrics and Child Health Clinical Examination. And I have seen that even very trained pediatricians, they usually struggle, they freak out when they are asked to do developmental assessment because of all the examinations that we do. This is one thing which is not that done that commonly, and most of the pediatricians are not very well versed with the details of developmental assessment. Obviously, they do the developmental history where they ask a few questions and they go according to the some of the important developmental milestones. But to do in a very elaborate way in an exam setting is something which is a very fearful thing for most of the clinicians practicing in pediatrics. And let me tell you that this is one of the permanent long case scenario in MRCPC exam. So one long station would be definitely a developmental assessment, and this is usually a 23-minute case where you are given 10 minutes for the history taking, then 2 minutes for your discussion based on the history, then you are given 8 minutes for the developmental assessment, that is developmental examination, and then there is 3-minute sort of a discussion with the examiner. So this is something which usually, I mean, most of the doctors, they freak out when we talk about the developmental assessment. But nevertheless, I think if you take a proper approach, this is one of the most easiest stations to pass. So keep it in mind that all you need is to do it in a very elaborate way. And please keep it in mind that it's not only that they are looking at your techniques. Basically, the examiners in MRCPCH clinical exam, they are looking whether you have gotten a proper approach for the child. You have got like sort of a sympathetic approach toward the parents as well, and you do it in a manner which makes it fun for the child. And the other thing that they are looking for is the language that you use in these type of examinations when you are especially presenting your case. So you have to be a bit careful about these things. Now, what this scenario or this station in the MRCPCH clinical exam, what it entails, it usually involves that where you have to take a developmental history, and then you have to you assess the developmental age of the child, and you have to identify domains in which the child is lacking. And once you have identified the lags, then you have to discuss it with the examiner, and then the examiner will ask you what are your future plans, or what will be your further management of this particular child. So this is how the station goes. So let's talk about this thing. Now keep it in mind that whenever you go into this station, the case developmental age would always be less than 5 years of age. I mean, the chronological age would be more than that. You might be given a child who is 8 years of age, but please keep it in mind that his developmental age would always be less than 5 years. So keep it in mind that developmental age in most of the cases would be less than 5 years of age. And the other thing is that you will be asked to examine the child in one or two domains only. You are not supposed to do a complete developmental assessment. Like, they don't want you to do global assessment, or like where you have to do gross motor, fine motor, vision, hearing, speech, and social domain. They will just give you one or two domains. So you may be asked to do a gross motor and a fine motor, or you may be asked to do a fine motor and vision only. So keep it in mind that since you'd be only asked to do your exam in one or two domains, when you are presenting your finding, always say to the examiner that I will complete my examination by assessing other domains of development as well, to see if there is any lag in other domains, or if there is a global delay as well. Because again, as I told you, that you are only assessing in one or two domains, so your examination is never complete. But nevertheless, because this is an examination setting, so the examiners want to see whether you have got a proper approach by saying that, okay, fine, I have done this exam, these are my findings, but I would like further I would like to do further examination by assessing other domains which I haven't done. to see if there's any lag there, and then make my plans accordingly. So these are few things that you must remember while going into the exam or going into this station particularly. Now, how to start the station? Obviously, in the circuits, you are given the scenario, so you are given some instructions. So before you enter the station, you have to carefully read your station scenario and the task that you are asked to perform. Like, for example, if you have been asked to do a developmental assessment, you have to do a developmental assessment. You should not be going too much into the history. Obviously, if you're not able to elicit something, then with the permission of the examiner, you can ask a few questions from the parents, but primarily your task should be focused on what you are supposed to do. The other thing is, never forget, whenever you enter the station, you have to put your hand gels before you start, so that everybody understands that you take infection control very seriously. Because sometimes under the pressure of the exams you might forget, and again that's something which is marked negatively. Then it's also very important that you greet the child with his name. Obviously that would be given when you enter the station. So most of the time they say, okay, well, George or Tony has got this problem. So you always greet the child with his name, saying who you are. So when you enter the station, you put the gel on your hands, you disinfect your hands, then you go close to the child and you say, my name is, let's say, Dr. ABC. Thank you for letting me examining you. And then you ask the parents, you greet them, and you also tell them who you are and say that I'm going to be examining your child for this particular thing. And in the meanwhile, you also tell them what are you going to do. So this is very important, that you greet the child by his name, you let him know what you're going to do, you also let the parents and the carer know what is going to be your approach, what you are going to do. Sometimes if you have to make them walk or run or something, you always ask the parents or the child if he can understand that, have you got pain anywhere, and is he comfortable to walk or run around, and then you proceed with the exam. That simply shows that you care. You care that if there is pain or something, then obviously you have to give him some painkillers, and then you will proceed with your exam. So while you are having this chat, observe the child initially, because a lot of information can be simply, you can get it by looking at the child. So you can look at his build, if he is small for his age, or if he's got any peculiar dysmorphism, like if he has got a typical face of Down syndrome, or let's say a typical faces of Hurler or Hunter syndrome. You also see whether he is playing around, he's moving around, or whether he's strapped to his chair, whether that's an electric chair, what sort of chair it is, and what activity is he doing. Because it also, like for example, a child who's playing around with the stuff that's lying there in the examination room, and he's running around, so you can know that his gross motor activity in the other domains are working, because he can at least run, and then you can do a detailed assessment as well. But if somebody is, let's say, wheelchair bound, so you know that there would be difficulties in, like in the gross motor domains. If a child is too much preoccupied with the things and doesn't give any attention to what is happening in the room, so you can get an idea that you might be looking at an autistic child, and there might be some problems in the social domain as well. So in a nutshell, I mean, just looking at the child, observing what he's doing, looking at his build, his face, the surrounding environment, gives you a lot of information and can guide you towards what you would be expecting in your exam, like when you're doing the assessment. Now, most of the times they would give you or they will ask you to do the gross motor assessment. Gross motor assessment or gross motor skills are quite easy to do. So, and even if you are not asked, like, and they say, okay, do a developmental assessment, so always start with the gross motor, because this is the easiest to do. And as far as gross motor assessment or examination is concerned, for sake of simplicity, you can divide it in 3 groups. So for children less than 6 months of age, for older infants, that would be 6 months onward, like up to 18 months of age, and then older children, obviously, who can walk and run around. So, and I've got a bit of understanding. So if you are given a child who is less than 6 months of age, obviously he's lying in the mother lap or something. So what you need to do is, or if you know already the task says that somebody is less than 6 months of age, so what you do is for less than 6 months, the first thing you do is place them supine. So you place them on their back, and what you examine at this time, you look at the tone, whether the child is totally has got a flaccid like limbs, not moving at all, or he's got an active tone. So he has got, like, that those flexed and posture of the limbs. So you feel for the tone. You also look at the posture. Is it a frog posture, or is it sort of an active posture where the child is moving all the limb? Also look at the roll, whether the child is rolling from side to side. Less than 6 months of age, it's also very important that you look at whether the child is making eye contact with you. So you come close to the child and you look him from left to right, see if the child is making eye contact with you, because that gives you an idea about the vision as well at the same time. You're not assessing vision at this moment, but it just gives you an added idea whether the child is making eye contact and whether the vision would be fine or not. Then after that, once you have examined him in supine position, then what you do is you hold the baby gently with hand and then you pull them up. So you bring them to sitting position. So now you are looking for the head lag. See if the head lags behind, if you try to bring them to sitting position and it falls forward or not. You also look at the upper limb and truncal tone. So you will get an idea. If the baby is very small, obviously doesn't have that much tone in the trunk or a thing, but obviously a child who is around 5-6 months of age should have some truncal tone, and it shouldn't be like like totally become sort of a rag doll, like just going forward and backward swinging. So you look for head lag, you look for upper limb and truncal tone while you are doing this assessment. After this, what you do is you will place the child prone. Now you put the child on the belly and you see whether the child is able to lift the head or is able to bring the upper limbs a bit higher against the anti-gravity movement of the muscle. So you put the child prone and you look at that. And you finish off the example by looking at the primitive reflexes. So the primitive reflexes, the Moro reflex, the tonic neck reflex, grasp reflex, and other things. You can do these as finishing off. You are not supposed to do all of them. You can just do 2 or 3 just to get an idea whether the primitive reflexes are still present, and you should know which primitive reflexes are present up to which age, and whether that is any abnormal presence of primitive reflexes or not. So okay. Then for older infants, usually you observe what they do. So for older infant who is 8-9 months of age, obviously it's a bit difficult like to put them in supine position, because they would get up and they would stranger anxiety is also there. So you just observe what they are doing. So if they are sitting unsupported, obviously you know that the gross motor or the proximal muscles have got good tone and power. See if he is able to crawl. You look if they are putting things in their mouth and using their limbs actively or not. So simply observing what they do can give you an idea about the gross motor skills. So gross motor skill, between 6 to 12 months, what they should be able to do, like sitting unsupported, crawling and things like so. Just observe those things and comment on that. For older children, like let's say 12 months onward or 18 months onward, then it depends whether the child is uncooperative or whether it is cooperative, because sometimes you might get across a condition and the child is very uncooperative. I mean, he's crying and he's not cooperating with you. He's not he's not doing what you tell him to do. So in an uncooperative child, what you do is you would just stand back and look at the gait. So see if how the child is walking. So the gait is fine. Obviously, it's got good power in the proximal side. Just observe how he's running and what they are doing. So what they do, like running around, there would be toys and other things there are. Remember, when you go into the station, there are few things that you have to use for your examination, especially for fine motor examination. You'll see there are a few toys, storybooks, crayons, piece of paper, scissors, blocks and things like that. And remember, you have to use some of them. You're not supposed to use each and everything of them, but you can use a few toys to do your assessment, especially when it comes down to fine motor and vision. So obviously, before you come into the exam, small kids, they might be playing around with some of these toys. So you just see what they are doing. And that would also give an idea if the child is uncooperative. Sometimes you ask the child to do something and they don't do because of the shyness or because of the environmental situation. So in that case, you can ask the examiner, you can ask that, am I allowed to ask a question? And then you can, if the examiner, definitely the examiner will give you permission, then you can ask the parents that, is he able to walk? Is he able to stand? Is he able to crawl? Or is he able to, things like that. So you can ask these things and that would give you an idea about the gross motor skills. For older child who's cooperative, and most of the times you will come across kids would be cooperative, you can look at different, you ask the child to sit and stand, so that gives you another thing how the proximal muscle power is. You can ask them to stand on one foot, you can ask them to jump, and you can ask them to kick a ball. And to make it, remember, because they are not only looking at your knowledge of development assessment, they are also looking at how you do these things, how much you engage the child, and you make this examination a fun for the child. So you can play a game and say, okay, come on, let's play football. So I'm going to kick it, and then you kick it, and then you see whether the child runs and kick the ball, and that would give you an idea about the gross motor skill. Similarly, you can ask, okay, let's jump. See, I'm going to see whether you win or I win. Who is going to make a higher jump? And then you jump and you ask the child to do that, and he smiles and he jumps. So you're trying to make these things fun for the child. So remember, even if you are not able to do all of these things, but you do one or two, but you have done it in a way that has, made that activity fun for the child, the examiner is going to give you marks. But if you do all these things, but you do in a way where, you make it hard for the child, obviously you will get less marks, because the examiners in this exam, they are not looking at whether you can do all these things in that limited amount of time or not. They're just looking at your approach as well. One or two things, but you do it in a fine way, in a manner that makes it fun for the child. Trust me, you're going to pass. So you, for cooperative child, gross motor, again, sit and stand, run, kick a ball, jump, things like that would give you an idea. And then obviously, if you know your developmental milestones, at which age the child should be able to do what, then you can get an idea what is his developmental age. And later on you can comment that, okay, according to chronological age and according to developmental age, this much is lag, or this much he's advanced, or he's exactly on his on his milestones. So this is how you do the gross motor assessment, and it's one of the easiest things to do. Okay, moving on. Fine motor and vision. Remember, fine motor and vision are connected with one another, because in order to do fine motor, or in order to obtain fine motor skill, a child must have good vision. A child who is blind would not be able to obtain fine motor skills, because the vision requires sort of coordination between the peripheral muscles that are used in fine motor. Okay, so fine motor are basically your hand muscles that the child uses for attaining different milestones. So again, for sake of simplicity, divided into less than 6 months, older infants, that is 6 to 12 months, and older children would be greater than 1 year. So for less than 6 months, fine motor, because you're looking at the hands basically and the fingers, so give them a toy. So see if they hold the toy, if they are able to hold it, whether they want to explore it. So usually the kids, they explore it by looking at it. They might move it from hand to hand, slightly older babies, and they would try to mouth it. So they try to explore it by bringing it to their mouth, so you can get an idea. So if they have got a good grasp of the toy, like a rattle or something, and they try to bring it to their mouth, try to explore other things, so what developmental milestones are they on. So for less than 6 months, easy, like you can just give them a rattle or toy and see whether they hold it properly, whether they pass it from hand to hand, and whether they mouth it, whether they explore it or not. Between 6 to 12 months, it's almost the same thing. It's giving them a toy and see how they do it. So again, it's more or less the same thing that around a 5-6 months aged baby would be doing. But you're also looking at the pincer grasp. So immature pincer grasp and mature pincer grasp. So at around 9-10 months away, they should have an immature pincer grasp, where they do not hold it like between the end of the thumb and the finger. They usually hold it like crudely like this. So you can give something and look at the pencil graphs, how they hold it. And you should know at, according to age, if they got the immature or mature pencil graphs. And then you try to let go of a toy. So if you give it to them, try to grab it back from them, so that you will get an idea how much power is there in the peripheral muscles, and that give you an assessment of the fine motor skills. For older children, again, you would see that in that room or that station where your developmental assessment is going on, you would see there are few toys and equipment that is there which you have to use. So there would be many things you would see. There would be a few cubes, beads, scissor, paper, crayon, picture book, small cars, spoons, things like that. You can choose a few of them, and practice would tell you which you should be using. So ideally for older children, use a picture book. You can use the crayons and a piece of paper to look at the drawing. You can use the blocks to see how much blocks can they build, and you can use the scissor as well. Again, depending on the time, you are not supposed to do each and everything, but you should be able to do at least 2 out of them, and in a manner that makes it fun for the child. Now, how you do it? So picture book, usually you sit down at the child. So if the child is there on the floor, you sit down and say, okay, let's go through this book. Okay, this is a story book. So can you just open this book for me, please? Or if he's not doing, he's a bit shy, you just open the book and say, oh, what is this? Which object is this? So obviously there will be something like a dog or a cat or a horse or something. So put your finger and say, what is this? So you are trying, if the child is able to pick up is able to point towards the object like a horse or a cat or a dog or a fish. So, and he might say it as well. So in the meantime, you can also get an assessment of his vocabulary as well. Is he able to pronounce that or not? So you look, and sometimes you put it, and the child might be, turning the pages. So again, whether they turn 2-3 pages in one go or one page, again, these are different skills which come at different age. So use the picture book, point to different objects and say what it is. Okay, which one is dog? For older children, you can say which one is not dog. Okay, and then that would give you an idea of the object recognition, which comes at different ages. So use the drawing book for young toddlers and see how much pages they can and whether they point at different objects or not. Drawing is also very important. So you definitely have piece of papers or cards and some crayons. So say, child, let's do some activity. So I will be making lines. Can you make it like that? So remember, ask the child, depending on the age, whether they are able to do the appropriate drawing as a fine motor skill for that age or not. And for that, it's very simple. If you look here, a child by 18 months should be able to make a rough scribble. So if you give a crayon and they just mark it roughly, make zigzag lines, obviously his developmental age is around 18 months. By 2 years of age, or 24, they should be able to crudely draw vertical lines. So if they are able to draw a vertical line around 2 years of age, horizontal line, they can draw it around 2.5 or 30 months of age. Then at 3 years, they should be able to draw circles. So if you see, I have made this diagram. It's quite simple to understand. This is a rough diagram of a man. So the head is a circle. So by 3 years, they should be able to make a circle. Then you've got the upper limbs in the form of a cross. So by 4 years of age, they should be able to make a cross. Then this is the tummy or the chest in the form of a rough square. So by 4.5 years of age, they should be able to make a square, and the triangles are the lower limbs. So by 5 years, they should be able to make a triangle. So what you do is, normally you don't ask, okay, make a triangle or something. So you would say, okay, let's play a game. I have made a circle. Can you draw this for me? And give it to, and the child would then try to draw or imitate it to see whether he's able to do that. So if a child is able to do that, like for example, a 3-year-old child is there, and you say, okay, fine, can you draw this circle for me? So if he draws a circle, then it doesn't mean that you will stop over there. And say, okay, fine, let me draw this cross. Okay, can you copy this cross for me, or can you draw this for me, and see if he can draw that. And you keep on going till you reach a maximum where the child can't do. Some kids might have some advanced developmental skills. So obviously at 3 years of age, they might be able to draw something which a normal child would be able to do at 4 years of age. So keep going till a child is not able to do it. Sometimes a child is able to do that, but because of the environment, or because he's distracted or he's not interested, or because obviously other candidates are also coming and doing that, child may become bored, so he may not give attention to that. He is able to do that, but he is not doing that. So do not comment on in such a case when you are presenting your case that he was not able to draw a circle. Probably he can do that, but he was shy or he was too tired. So you would use the words, because they also are looking at the wordings that you use. So you would say, okay, George was not able to demonstrate today making a circle. So don't say he was not able. He was not able to demonstrate, and that might be because of the stress, or might be because he was quite shy. But obviously, I would like to repeat this in a more favorable environment. So when you say these things, so the examiner knows that that it might be this situation where the child can't, and you need some more conducive environment where you would like to re-examine the child to before you comment on that. So obviously, you will get marks for that. So you ask the child and you make it fun for the child. So you do something and ask the child to do that and see whether they do it. If you repeat, if the child is not doing, you ask him 2-3 times. After 2-3 times, if he's still not doing, again, as I said, he might either be not able to do it, or he may not be interested at that point in time. So simply do not waste your time. Move on to another something else. So then you can try the blocks as well. So blocks are something which children love, and say, okay, let's play a game. I will make few blocks and see, can you make this block for me? Okay, we'll make a tower and do it for me. So remember, by 15 months of age, a child should be able to make a tower of 2 blocks. By 18 months, 4, and by 2 years, 8. Different books have said different things. Some say 6, some say 7, some say 8 by 2 years of age. Nevertheless, you use any scale that you are comfortable with. It doesn't make any difference by 1 or 2 blocks. So you can ask, okay, let's build this and see how many blocks he can put on top of one another to make a tower. And you should remember by which age he should be able to make a tower of this much blocks. And then if you have got time, you can give them a scissors and say, okay, can you cut this paper for me? And you cut, and then you ask the child to do, and see, by 3 years of age, he should be able to make a single cut where he just gives a rough cut into the page. And by 4 years, he is usually able to cut the paper in half. So if he cuts, it may be a rough, not a clean one, but he cuts the paper in 2 pieces in half. So by 3 years and by 4 years, a single cut or a rough cut going through whole of the page, cutting the page in 2 pieces, he might be able to do that. So usually in most of the times, in most of the stations, most of the centers, they give you older children. It would be very rare that they give you a very small one, because they know obviously there's nothing much that you can do in very small children, and there might not be much information. So they want to see you how much you want. So usually in most of the cases, they will give you older children. So again, as I said, picture book, blocks, drawing, and scissors. You can use it to get an idea of fine motor and vision, obviously because they are related with one another. So that you would complete your examination of fine motor and vision by doing these things in older children. Now moving on to speech, language, and hearing, and they are related with one another. So speech and language, again, they are related with one another. Language is receptive as well as expressive, and that is based on hearing as well. So these are connected. So they are usually assessed in one domain. So obviously, if your task says that you have to do assess the speech, language, and hearing of this child aged 3 years, so you have to go again, start by disinfecting your hand, introducing yourself, thanking the child for letting you examine him, and then you move on. So again, for babies, what you would do, again, you would use a rattle and see if the baby turns head. So you just you use the rattle and see if the baby turns heads toward the sound of the rattle. You also look, okay, and see if the baby is making any cooing sounds, or he's babbling, uh, and then if you let's say if you observe nothing during that time, then with the permission of the examiner you can ask the parents if they have got any concerns regarding his hearing or speech, or whether he has been babbling or whether he's been cooing or not, because sometimes it by chance at that point in time they might not do it. So then you have to ask whether he is able to do that or not. You can't simply say that he's not able to do that. Again, you will say that he was not able to demonstrate, but I asked the parents and they say he can do it. So that makes that he's appropriate for his his development. This development is appropriate for his age. You can comment on it later on. For older children, again, who are between 1 to 2 years, and those who are greater than 2 years. So for between 1 to 2 years, so again, because you're looking at the hearing and speech, so you call them by their name, see if they respond. So you say, okay, hello George, how are you? Hello George, look here, and see if they respond to you. You can ask them, George, where is your mommy? Can you just point where your mommy is? Okay. So again, they might point, oh, that without speaking, they might point over there. So it simply means that they are hearing. You can simply, depending on the age, you can ask them, okay, George, can you tell me where is your nose? Okay, or where is your eyes? Or can you show me your lips? Or can you point to your lips? So these are the few questions that you can ask to a child who's between 1 and 2 years of age, and you can get an idea whether his speech, language, and hearing. For older children, I guess you do the same thing. You will say, what's your name? Again, you can ask them if he can count. If it's an older child, just see if he can count 1, 2, 3, or sometimes ABC. You also check them on some do's and don'ts, like can you just pick up, like for example, you can put some toys like a car and a spoon and a small plastic plate, and you say, okay, can you pick up and give the car to me? So he will, if he is able to do that, so obviously you would make a note of that. If he's not able to do that, or you can simply say, do not put the car, or do not pick the car, or pick the other thing except car and give it to me. So see if he picks up a spoon and give it to you. So do's and don'ts. You see if he understands do's and don'ts. So that would also give an idea of whether he understands nouns and adjectives and prepositions. And you can give complex commands as well. So complex commands, which usually come at a bit of a higher age, like above 3 years of age. So you can ask, okay, you put all these toys and you say, okay, George, can you give me the car? And after giving me the car, go to your mommy. So if he hands over the car to you and goes and he's passed. If not, you can ask him again. So things like that. So you will be looking at do's and don'ts and be giving them some complex commands, which includes doing 2 things in succession and see whether they understand it or not. So this would give you an idea of the speech, language, and hearing. And you can ask them, okay, tell me, you can point, what is this called? So if he says this car, or if there's a small dog or horse, toy horse, you say, what is the name of this thing? And you see if they can name these objects or not. Again, if they are not able, say he was not able to demonstrate, rather, like he can't do that. So again, do not make very crude, explicit statement. Just try to rephrase or phrase it in such a way that is it doesn't put a label on the child that he's not able to do something. Then moving on to the social domain. Social domain usually is not that much asked in the exam, but remember, much of the social domain assessment is just looking at what the child is doing. Usually social domain problems are with autistic kids, and just by observing that, what is he doing and how is his interaction with the parents would give you an idea. So a child who's very much preoccupied by himself or with his toy, and he's not bothered, he's not looking at his parents. Even if the parents ask him, you ask the parents if to ask him to come to you, to them, and if he responds or not. So much information can be simply collected by observing what the child is doing. So you ask for the child name, see if he responds to you, whether he looks at you. If he doesn't respond, then say it louder. See again if he responds or not. If he's still not responding, and if he's fixed on a toy or something, you ask the parent, okay, please, can you take this toy away from him? And see if he gets distressed if that toy is taken, because if there is some sort of object fixation and he's fixed on some activity, usually kids who've got problem with social domain would usually become very much distressed. they can offer him some other toy and see if it comforts him. If it's usually with autistic kids, they would not be comfortable with the toy. They want those things back which they are fixed with. So you see, and then you look at the interaction with them. If he's totally aloof of the environment and he just fixed, then you know that he's not giving you reciprocal attention. He's not smiling, or he's got fixed on a particular activity and he gets distressed. So you can comment on all these things that you know. So once you have done it, then and remember that you would have 8 minutes for your this assessment, developmental assessment, and then you will be having 3 minutes for your presentation or presenting your finding. So as I told you earlier, that whatever you have noticed, you have to use the language very carefully, and always say, if you find something that the child was not able to do, say he was not able to demonstrate, and I would like to do this thing again to see in a more conducive environment too, before making any concrete comment on that. And also give your findings domain by domain. So if you've been asked to do a developmental assessment in 2 domains, then you say, okay, my child today, George, so first I examined the gross motor. So in the gross motor, he was able to demonstrate this, but he was not able to demonstrate this, which makes his gross motor developmental age this much, which is less than or appropriate for his chronological. Then you go on to the other one in the social domain or in the fine motor and vision domain. George was able to do or able to demonstrate this, and was didn't demonstrate this again, which makes his developmental age ABC whatever. So again, depending on whatever your respective findings were. And as I told you earlier, always say that I would like to complete my assessment by doing a full, like I would like to do a full developmental assessment by examining other domains of development, which I haven't done today. I would also like to do a full neurological examination to see if there are underlying neurological reasons for my findings, and also plotting the anthropometric indices, which is height, weight, and what you call the head circumference on appropriate graphs. At this point, the examiner might ask you for further management plan, which obviously depends on your findings. But to mention, most of the cases, these kids would need a multidisciplinary approach. So you say, well, I would like to involve the community pediatrician in the further management. I would like to involve his GP and health worker if there is and further I would like to do some further assessments, which includes but is not limited to, it might be chromosomal analysis by MRCPCH method, or I would like to get an ophthalmology opinion and audiology, complete audiology assessment. I would like to do Frax gene assessment if it's a boy and you feel like there is some developmental delay and problems with intelligence as well. Would like to do like a thyroid function test, would like to do neuroimaging, creatine kinase, especially if you are suspecting DMD, and would like to do a metabolic screen as well. So you can use a combination of these things so that the examiner knows that he's not asking you for a diagnosis, he simply wants to know if you can pick up these findings and you can make some further plans, because obviously these things would not give you a conclusive diagnosis. You need to diagnose further, so you need to involve the appropriate persons, and you might need to set the ball in motion by doing some basic things, would help the MDT team then to take it on further from there and reach a diagnosis. So if you do these things, you're going to get a pass in that. Also, please keep it in mind that sometimes they might give you a case in which there might be different findings. Like for example, they might give you a diaplegic cerebral palsy, where the gross motor is, let's say, is lower than his chronological age in the lower limbs, but everything is fine in his upper limb. So then you would say that when you are presenting, you would say the gross motor skills in his lower limbs was this, which conforms to a developmental age of this, which is less than his chronological age. On the upper limb, it was ABC, which is appropriate for his chronological age, but because of the lag in the gross motor skill in the lower limbs, I would like to do further assessment by doing, and again you can go through the same scenario which I just told you, and which is there on the slide, that I would like to involve the multidisciplinary community pediatrician, neurological assessment, blah blah. So if you are given a case where the gross domain is a bit different in upper and lower limbs, so you will put the developmental age according to the lower limb. So you will not put the developmental age according to the upper limb, where you say, well, his developmental age is appropriate for his chronology. No, because the lower limbs are lagging, where the developmental milestones have not been achieved. So you will give his developmental milestone according to the findings in the lower limb, and you present it in that way. So I hope I have tried to explain the developmental assessment in very simple words. Also keep it in mind that you can use different types of scales for developmental assessment. Different books have got different timelines for achieving different milestones. Stick to whatever you are comfortable with. It doesn't matter, it's not that much different. But the important thing is that you are able to do this within limited time. Your approach is appropriate. You do it in a fun manner with the child. This is the most important thing. You engage the child, you make it fun for the child, and you use your language appropriately. Trust me, if you do these things, you will pass this station. I hope you have liked my video. If you are watching for the very first time, do subscribe to my channel, because it gives me more courage to make some more videos for you guys. And if you like it, please share it with your friends. Give me a thumbs up, and have a good day. Bye bye.